what is hypertension? So hypertension is a condition when there is an increase in the blood pressure. So blood pressure is the pressure exerted by the blood against the normal vessels in the body. So when measuring a blood pressure, there are two values, systolic as well as diastolic values, which we call as systolic blood pressure and diastolic blood pressure. So the normal systolic blood pressure is up to 140 millimeters of mercury, and diastolic blood pressure normal will be up to 90 millimeters of mercury. So hypertension is called when the blood pressure exceeds 140/90 millimeters of mercury. So for hypertension, we have certain risk factors. So we can classify those as to modifiable risk factors and non-modifiable risk factors. So non-modifiable risk factors will be the family history of blood pressure. Like if you have blood pressure running in the family, so definitely you have a high chance for blood pressure. And then next will be age. So as the age progresses also, you will have chances of increasing blood pressure. So next will be the modifiable risk factors, which we can control it. So one thing is like obesity. If you are overweight, so by reducing the weight, you can control the blood pressure. So the next thing is diet. So excessive intake of salt in the food as well as fatty foods. All these things can cause an increase in blood pressure, as well as consumption of alcohol, tobacco. All these things can cause increase in blood pressure. So in a way, we can control the modifiable risk factors by our lifestyle changes. So why is hypertension important? So hypertension is otherwise known as a silent killer. Most of the times people doesn't know they have hypertension. So it's an easy way to find out blood pressure or hypertension. So just go to any clinic or any doctor, any nurse, so they can check the blood pressure and diagnose whether you have hypertension or not. So it's not just enough that you have just one reading to diagnose you with hypertension. So we will have to have at least 3 consecutive readings, maybe on the same day at different times, or different days we can check. So as well as when we find there is a hypertension, so we have to act. So if you don't act, there are a lot of complications. So what are the symptoms of hypertension? So basically, you can have headaches, you can have chest pain, you can have giddiness, you can have numbness of the body, you can have irregular heartbeats, fatigue, nausea, tiredness. So all these are symptoms of hypertension. So if you have severe hypertension, so the symptoms can be even more severe. Like you can even become unconscious, you can be confused, there can be chest pain, anxiety, tremors of the body. So even there can be a sudden visual loss also. So if there are complications like severe hypertension, which can lead to heart attack and even a stroke. So this stroke can cause, there may be rupture of the blood vessels leading to bleeding in the brain, so leading to severe complications. So these complications can be avoided by just controlling the blood pressure, just taking the proper medicines and doing proper diet and exercise. So how do you prevent it? So how can you control it? So prevention is basically by reducing the salt intake. So if you have a hypertension, or if you are prone to have hypertension, like if you have a family history, so it's always better to take less salty foods. So salty foods, that means reduction. The total daily salt intake should be less than 5 grams per day, and you should increase intake of more fruits and vegetables in your diet, and should avoid excessive alcohol consumption, avoid tobacco use, and be physically active. You should do exercise regularly, be active, and if you have a sedentary lifestyle, make sure you do your daily walking, jogging, or hit the gym. Okay, and avoid taking fatty foods. And if your blood pressure is not controlled with these measures, definitely you should consult your doctor, and the doctor will be prescribing you medicines, and you have to take the medicines regularly and do a regular checkup. So it's not necessary that you take a medicine and you leave it saying that you have medicine for the pressure. You should check your blood pressure and make sure it is under control. If it is not under getting control, so we have to make those adjustments for the tablets. So you should check with your healthcare provider and make sure your blood pressure is under control, and so that we can take care of this silent killer. Have a good day.